Good morning, good afternoon, whenever you're watching this. Hopefully it has been good for you. I am Karen on Empowering Two Health's channel, and welcome to our video today. And I want to share a article with you that I wrote that is focusing on a very important part of our body, our heart. And so this is being filmed in February, and February is Heart Month. And we hear a lot about that usually. I know I haven't noticed as much this month, but at the beginning of the month, people wear red on the designated day. You're encouraged to get your cholesterol checked, maybe even have a heart test done. And all of this is really important, not only in February, but in any time of the year, not necessarily the testing, but being aware of your heart health, because coronary artery disease is a leading killer of men and women in the United States. So it definitely deserves the attention it receives. Heart disease affects more than just your heart, though. It impacts the blood vessels through your body. And the research is finding that poor heart health actually can increase your risk of Alzheimer's disease. However, being made aware of this and implementing a plan to improve your health is not the same thing. So making a plan involves action and a commitment to do something. The best plan for your heart health, though, does not necessarily just involve cholesterol-lowering drugs like statins, or using olive oil, which is advertised as heart healthy, but eating a whole food plant-based diet. And there is a surgeon whose name is Caldwell Esselstyn Jr. He was at a prominent hospital, and he began to notice that while his patients' surgeries were what were considered successful, his patients were getting healthy. So he decided to do some investigating, and this led him to a connection between diet and health. So he began with a small research study using some of his own patients in 1985. And there were 24 people that he was looking at. And they were put on a strict whole food plant-based diet. Their cholesterol dropped from an average of 246 to below 150. And many patients, their disease was reversed or slowed down. None of the patients who adhered to this diet had any more heart events, and those would be things like heart attacks, heart procedures, angina symptoms, things like that. There were 6 patients out of his original ones that left the study and went back to eating the standard American diet. These patients were also followed, and it was recorded that they had 13 heart events, which included bypass surgeries, angioplasty, and there was 1 death. Now, it should be noted that during this time, all the patients were also still on their statin drugs. In a more recent study, Dr. Esselstyn used 198 patients to determine the effects food has on our health. Still, it's a small study, but the first one, even though there was a small amount of people, it had big effects. So in the second study, the results showed that 90% of the participants remained on the whole food plant-based diet the entire study. This group had a 0.6% rate of heart events found as a result of the diet. This is compared to a 62% rate of events of those who did not follow his food recommendations. So as a result of all of this, he came to the conclusion that diet can be a primary cause of heart disease. And his message is that coronary artery disease doesn't need to exist, and if it does exist, it really shouldn't be progressing. So what does Dr. Esselstyn's dietary pattern look like? First, let's start with the air quote, bad news. You cannot eat any meat, poultry, fish, dairy products, or oil of any kind. And most people then are also told to not eat nuts and avocados. But then what you can eat are foods that are full of nutrients. And these include things like vegetables, again, except for that avocado, beans, peas, lentils, all whole grains, breads, pastas, and those should not have any extra added fat, and fruits. Because his patients are literally eating to save their lives, he insists on them completely adhering to this diet. But if you are implementing something like this just to try and prevent heart disease or improve your health, small amounts of the nuts and avocado could be included. Dr. Esselstyn is now in his mid-80s. I saw him at a conference several years ago, online about a year ago, and he looks really good. And he follows his own recommendations, and he continues to help people. With COVID now, I'm not sure how that's looking or what he's doing, but up until this point that this all started, I know that he was. A couple years ago, he was leading a part of a class that I was involved with, and he told an account of a woman that had been told by her cardiologist that nothing could be done for her and she should, quote, get her affairs in order. So she was seeking out alternatives, and she came to him as the last resort. And she adopted his eating pattern. And as a result, she ended up living another 20 years of good life. So he has written a book that documents his research. It goes into more detail about the science of it all, and then why his approach works for long-term health. Empowering True Health can help you transition to a healthy eating pattern any time of the year, not just during, Heart Health Month. And, it's really important as a part of, getting your body in good condition to fight any diseases that might come up, that, you really do look at your diet and eating pattern. Now, I encourage you to do some research on your own. Either online, you can look through my website, sign up for the newsletter. I send out information about that. And if you don't have heart disease, you can still consider implementing this in a less strict way as compared to Dr. Esselstyn, so that you continue being heart healthy as long as you can. So until next time, stay healthy and have some fun.